watching Fox 26 News, your station for life.
We have new results to share with you from a promising treatment for Parkinson's disease and multiple sclerosis.
A group of patients underwent infusions of plasma. Now they're starting to tell a difference in their disease. A blood bank called New Plasma in the Texas Hill Country is helping patients right here in the Houston area. They extract plasma from young donors between the ages of 18 and 25, then infuse it into patients who have Parkinson's disease and multiple sclerosis.
We're honored to be a part of it as the study supplier, and we're hoping that this study leads to more clinical trials, which will lead to more data, more results, and hopefully will become more widely accepted by the medical community.
Doctors are closely monitoring the group of patients to find out how their disease is responding to plasma.
We've had results better than we could have imagined. We looked at, if you remember, 40 patients, 20 with MS, 20 with Parkinson's. Half got the young, fresh frozen plasma, and half got placebo. And what we found 1 month out is a huge improvement in significant categories. So the neurologists look at MS and Parkinson's patients with their assessment, the patient's personal assessment, and objective blood tests. And in over 50% of the parameters, especially fatigue, Parkinson's tremors, day-to-day activities, work, movement, mood, behavior, there was a significant improvement in the young, fresh frozen plasma patients versus the placebo patients.
Dr. Ginsburg says they're hopeful those symptoms will get even better over the next few months.
While we're super excited today, we're going to be even more excited in 3 months, because if what we see continues, anything that was placebo controlled, or we believe that patients may have, okay, I think I got the plasma. Do I feel better because I think I got the plasma? At 3 months, we're hoping most of that placebo stuff will be gone. So we'll start to see even a bigger separation. The placebo effects will be even less, and the plasma effects will be more.
The Food and Drug Administration has been closely monitoring plasma labs and has recently closed them down that were offering it to be the fountain of youth. Wade says what they're offering patients is different than that.
New Plasma performs 17 tests standard, whereas most blood banks only perform 12 standard tests. And those 5 additional tests are actually our most expensive tests, and that's probably why most other blood banks don't perform those tests. But the reason for that is patient and product safety and quality. Product quality has always been at the center of New Plasma's focus. So when the FDA brings up some of these concerns, as they did in the February report, New Plasma was actually created to meet or exceed all of the things that they brought up.
Wade says the plasma is off-label, which means they use an FDA-approved treatment for an unapproved use.
Plasma has been in use in the United States for almost 100 years, since the early 1920s. And even today, plasma is used over 10,000 times in the United States, and that number comes from the American Red Cross. Botox is one of those, for example. In fact, 21% of all medications and prescriptions in the U.S. are considered to be off-label,
which equals millions of prescriptions. Patients have been more than willing to try plasma to reduce their symptoms and are hopeful their quality of life will increase.
Hopefully, in giving the young plasma with all the wonderful proteins and factors that it has, what will happen is it will go to the specific negative of each individual person, and whatever isn't working will start working again.
So much hope for these patients. Now, as you heard, half of those patients in the study were just given a placebo, but luckily New Plasma has agreed to donate plasma to all of them once this is over. So at the 6-month mark, they will then all get it, and they'll hopefully all benefit from it. So they will find out soon if they are. And then those patients can talk to us. At this point, they're not allowed to know if they have the plasma or not, so they can't talk to the media, but I hope to talk to them in a few months.
Now, are there other things that they hope plasma will help with beyond just Parkinson's? Well, I mean, the list goes on, I guess, as far as diseases go,
You would sure think that this might be the beginning of a whole lot. So at the end of this study, it will tell a lot, and then it'll hopefully go to the next phase.
All right.
I'll keep you up to date. 9:33.